part of what I'm trying to do is to really build on what Andy has talked about, which is that these crises related to climate change, the crises related to war, conflict, and militarization, the economic crises related both to continued poverty and immiseration, but also this growth in wealth inequalities, not only interconnect with each other and threaten to create a vicious cycle. And with climate change, it's a vicious cycle that really does threaten not just the health of the poor, but the future health of humanity itself. That they all share a set of common social and political pathologies. And Medact is an organization that seeks to harness the voice, the mandates of health professionals to address these underlying social and political pathologies. And I hope I don't sound too radical when I talk like this, because I know I have been labeled as such. But in reality, I'm actually a very mild and moderate person. And I feel like all I'm doing is merely reacting to the facts on the ground. But if these are the social and political pathologies that we face, what are the corresponding vaccines and treatments for these pathologies? I'd like to begin with hope and courage. I know that when I talk to my students and when I talk to my colleagues about climate change, when you actually start to look at the science of the potential effects of runaway climate change and the dangers that are inherent in global warming at 2 degrees, which is a level of global warming that I think we cannot avoid now, it is truly frightening. And you begin to feel a sense of actual hopelessness. And I think there is a large degree of apathy in the public that is driven by a sense of disempowerment and hopelessness. So I think hope is going to have to be one of the vaccines and treatments that we inject into the public if we are to address these underlying social and political pathologies. And courage is the other, because if we are to truly confront malign power, if we are to truly confront the corruption of science, the corruption of politics, the undermining of democracy, courage is going to be required. And there are many examples of doctors and other health professionals who exhibit courage and who provide us with a source of inspiration and motivation. And this is just one person, one of my heroes, Dr. Binayak Sen, who was incarcerated by the state for his work in improving the health of tribal peoples in India. Knowledge and understanding is going to be an important aspect of our treatment of these pathologies. Certainly if we are to deny the power of false propaganda and the spin and the untruths that so many people in the public are exposed to, we're going to have to think about how we can not just create knowledge, but transmit it and communicate it to a wider public. We're going to need imagination if we're to believe that another world is possible. We're going to need imagination if we're going to be able to imagine a world, a low-carbon world, an alternative to the consumption-based world that we currently live in. We're going to need organization if we're to be effective in making change happen. And like I say, we need a bit more public health to harness the critical tools of epidemiology, of rigorous analysis, all of which I think are vital to support the campaign and the work that's required to effect real change. A staff of only 2.2 people, full-time equivalent. It's got an office in London, an income of only about 110,000 a year, Much of that income is independent. 95% of it comes from membership subscriptions and private donations. And this conference, this relaunch conference here, is all about looking to see how we can revitalize Medact, how we can grow and build the organization. And the reason why we want to do this is because we feel that there is a need for an organization of health professionals to act upon these upstream determinants of health and to approach health from a social and political perspective. Specifically, to harness the expertise, mandate, and social standing of this community. In revitalizing Medact, we're going to continue with having a broad agenda. We're setting up 4 discrete programs within Medact: weapons and war, economic justice, ecology and climate change, and health and human rights. We're having a broad agenda for strategic reasons. This is a deliberate choice being made, and there are many people who've advised us not to try and adopt such a broad agenda, because you lose focus. It's much more difficult to achieve impact across such a broad agenda than it might be with a more focused, narrow, and selective agenda. But I think, as Andy has said, there are important interconnections between these different issues. And part of what Medact is set up to do is to draw attention to these interconnections and the synergies, both negative and positive, that exist across them. What are our hopes for the future? Medact is small now, but we're hoping over the next 2 to 3 years to grow the organization, to reach a point where we've got enough income to hire 5, possibly 10 staff, if we're really ambitious and successful, to grow our membership from its current base of about 850 to 3,000, but at the same time to be able to harness the support of tens of thousands of health workers in the UK around campaigning work and advocacy campaigns. There are over 1 million health professionals, health workers in the UK. So it seems not too ambitious to talk about harnessing tens of thousands of those health workers to address some of these social and political pathologies. We want to target and advocate and change and shift the behaviors and policies of politicians. But in addition to that, we see Medact as being an engine for progressive change within the wider health community. So part of our key advocacy targets will include politicians, but they'll also include the other professional organizations of our community, such as the BMA and the Royal Colleges, WHO at the global level. We're intending to increase project-based funding, and importantly, what we want to also do is to provide a platform for the many other existing health campaigns and initiatives that already exist, but which currently exist in an atomized and fragmented and uncoordinated manner. There's a lot of progressive health activity happening out there, but not all of it is organized as well as it can and should be. Part of the revitalization of Medact and the relaunch of Medact will include a new website, an improvement in its ability to communicate. And we're paying lots of attention to thinking about the organizational structure of Medact. How do we organize a membership-based organization to be at the same time effective in campaigning and shifting policymakers and being effective political change agents? We're looking at an organizational structure that includes a board, office, and staff members. And we're looking to create 4 separate councils for each of the programmatic areas of Medact, and looking to invite people to be part of these councils to set the strategic direction of Medact over the next 2 or 3 years. Somehow we've got to involve people, members, the wider health community, in taking part in activities that relate to Medact. So how do we set up viable project activity and local area groups? That will be one of the challenges of Medact over the next 2 or 3 years. And importantly, how do we build alliances with other groups working on similar issues? I think it's amazing that we've managed to get at this conference the input of ecologists, lawyers, economists, who are all keen, in fact quite desperate, to talk to us in the health community. Desperate to be able to harness the social standing, professional mandate of the health professional in support of the work that they do. So establishing these partnerships with progressive lawyers, with progressive economists, is going to be an important part of Medact's transition over the next 2 or 3 years. And given the global nature of so many of these problems, an additional challenge will be to establish partnerships with sister organizations in other countries. So this idea of growing Medact, revitalizing it, changing it, developing it into a vehicle that can truly harness the voice and the power of the health community is probably going to take 3 or 5 years. And I'm hoping that this conference will be the beginning of a set of activities that will lead up to this. This will include strategic planning around the work of Medact in the 4 programmatic areas, conducting more policy and analysis work so that Medact can arrive at fairly concrete policy positions and arrive at concrete campaign objectives. There's going to be lots of work required around fundraising, mobilizing the wider health community, establishing partnerships, coalescing with other groups, and ultimately, over the next 2 or 3 years, campaigning for effective change. So, with that, I invite you, those of you who are not members of Medact, those of you who are members of Medact but who are not perhaps actively involved in Medact, those of you who are not yet members of Medact, to please join us in revitalizing the organization, growing it, developing it, and helping it to mobilize the wider health community. Much of what's been said today has been of a serious nature, and I hope that over the course of the next few hours today, we will also be able to be both serious but enjoy the company of good people who've turned up today and have some fun as well. Thanks very much.